Good evening, everyone. My name is Liz Debut, and this recording is to serve as the discussion for the neurological assessment. In this recording, I will be focusing on the most important questions to ask the patient about their current health concern. In this scenario, the patient, Brandy, is a 35-year-old female who presents to the office with complaints of feeling unsteady when she walks, in addition to experiencing odd sensations in her lower extremities, such as her pants having static cling. The patient also has a history of migraine headaches that normally respond well to ibuprofen. Questions that I would ask this patient include what brings you into the office today? And we know that the patient is feeling unsteady when she walks and is experiencing paresthesia in her lower extremities. Then I would ask such questions as, when did the unsteady gait start? Was it a sudden onset or a gradual onset? Is the unsteady feeling constant or intermittent? When did the sensation in your lower extremities start? Was their onset sudden or gradual? Are the sensations constant or intermittent? What precipitates the unsteady feeling when you walk? What are you doing when it happens? What precipitates the feelings in your lower legs? Does anything help with the unsteady gait? Does anything help with the paresthesia in your lower extremities? What makes your unsteady gait worse? What makes the paresthesia worse in your lower legs? How long do the unsteady gait episodes last? How long do the paresthesias last? When was the last time that you felt unsteady while walking? When was the last time that you experienced the paresthesia in your lower legs? They do have a history of migraines, so I would ask, what precipitates your migraines? How long have you had migraines? What helps the migraines? What makes the migraines worse? Does rest help the migraines? Do you have migraines when you're feeling unsteady while walking? When was the last time you had a migraine? You reported that you take ibuprofen to relieve your migraines. How much ibuprofen do you take, and how often do you take it? Other questions I would ask include, do you smoke tobacco products? Do you drink alcohol? Do you use recreational drugs? If the patient answers yes to any of these questions, I will ask what kind, how much, and how often. I would ask if the patient was in pain, and if so, how long has the patient been in pain? Was the pain sudden or gradual? Where is the pain located? Does the pain radiate? What helps the pain? What makes the pain worse? Is the pain constant or intermittent? What has the patient done to try to help the pain? Has the patient tried any home remedies? Has the patient used heat or ice application for pain relief? Does rest improve the pain? I would also ask the patient how the unsteady gait and paresthesia has impacted their home life and or work life. What kind of stressors has the patient's health issues placed on the patient? Does the patient have assistance at home? What is the patient's home life like? Does the patient live alone? Do they have a support system? Do they have health insurance? Do they have a place to live? Does the patient have access to food and running water? Does the patient live close to a grocery store? Is the patient employed? What does the patient do for a living? Has the patient had to miss work due to their current complaint? Does the patient have transportation? Then I would ask questions about general symptoms, such as, what medications do you normally take? Are you taking any new medications? Do you have any allergies? Have you had a fever? Have you had any chills? Have you felt fatigued or experienced a change in your energy level? Have you had any nausea or vomiting? Have you experienced any night sweats? Has one side of your body felt weaker than the other? Have you felt weak? Have you experienced any auras? Have you felt dizzy? Have you experienced a loss of coordination? Have you experienced any scotoma, such as blind spots in your field of vision? Have you had any numbness or tingling sensations? Has your face been flushed? Then I would ask questions about mental health, such as, have you felt depressed? Have you been feeling anxious? Have you felt more irritable lately? Have you had any problems concentrating? Have you felt confused? Have you felt suicidal or homicidal toward another person? Then I would ask questions about vision, such as, have you had any changes in your vision since your gait has become unsteady? Have you ever had blurry vision? Have you had any vision problems in just one eye? Have you had any sensitivity to light? Next, I would ask questions about the ears, nose, and throat, such as, have you had any congestion? Have you had any ringing in your ears? Have you had any hearing loss? Have you had any difficulty swallowing? Then I would ask questions related to family history, such as, do you have a history of migraines in your family? Do you have a history of epilepsy in your family? Do you have a family history of Alzheimer's disease? Do you have a family history of Parkinson's disease? Do you have a history of any other neurological diseases or chronic diseases in your family, such as diabetes mellitus, cancer, heart disease, stroke, or arthritis? Further testing that I would recommend for this patient would be to check the patient's cerebellar function by assessing their balance and gait. This would be accomplished by observing the patient's gait as they walk normally. Then I would perform the Romberg's test to look for swaying as the patient stands with their feet together, first with their eyes open, then with their eyes closed. If the patient cannot maintain their balance, then the Romberg's test is positive. Patients with multiple sclerosis often present with a positive Romberg's test, according to Rhodes and Peterson, 2021. Another test that I would recommend for this patient would be to evaluate the patient's sensory function by assessing their exteroceptive sensation, which would be done with the patient's eyes closed. This test uses a cotton wisp to apply a light stroking stimulus to the patient's skin, starting at the distal end of the limbs and moving proximally following the dermatomal distribution. A sharp and dull object should also be used to test the patient's perception of superficial pain, as well as using cold and warm water to check for temperature perception. The patient should be able to discriminate between all sensations. Absent touch sensation in the hands and lower legs is common in polyneuropathy, according to Rhodes and Peterson, 2021. Polyneuropathy is also known as peripheral neuropathy. The two differential diagnoses that I am in support of are peripheral neuropathy and possibly multiple sclerosis. The clinical presentation of peripheral neuropathy widely varies depending on the underlying disease process. Patients may complain of symptoms initially, starting in their digits, progressing to their proximal limbs. Symptoms range and include changes in sensation, weakness, unsteady gait, atrophy, pain, numbness, and even autonomic disturbances. Advanced disease may progress to reduced or absent deep tendon reflexes, stocking glove pattern sensory loss, muscle wasting, and weakness, according to Hammy and Young, 2021. Multiple sclerosis, the most prevalent neurological disability, is an autoimmune mediated disorder that affects the central nervous system and often leads to severe physical or cognitive incapacitation, as well as neurological problems in young adults. Common symptoms include sensory disturbances such as numbness, tingling, itching, and burning, walking difficulties due to fatigue, weakness, spasticity, loss of balance, and tremor, vision problems such as diplopia, blurred, and pain on eye movement. Intestinal and urinary system dysfunction, such as constipation and bladder dysfunction, cognitive and emotional impairment, such as an inability to learn, along with depression, dizziness and vertigo, and sexual problems, according to Gassini et al., 2017. And this concludes my discussion on the neurological system. Thank you for listening.